subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors today. We have a familiar face here, Dr. Rajesh Dharia, whom we are delighted to have here amongst us again. And he is going to be talking about knee replacement and knee care in seniors. A little about Dr. Dharia, because some of you already know him. He is a leading consultant orthopedic and joint replacement surgeon based in Mumbai. He has performed over 9,500 replacement surgeries. He's worked on knees, and an award-winning doctor. He's just won a big award recently in Delhi. We were discussing. Dr. Dharia is trained in Mumbai, UK, Germany, the US, Japan, and Australia. He operates at the Saifee, Breach Candy, HN Reliance, and the Cumballa Hill Hospitals. All of them are in Mumbai, amongst others. Welcome to Health Live at Seniors today, Dr. Dharia. How are you?
I'm fine. Thank you for that introduction once again, and nice to see you again on Seniors.
Absolutely. And tell us, doctor, what's the scene of COVID these days? Is it, we were speaking to a senior urologist last week from who is with Nanavati Max, and he was talking about things being under control. But since things are happening so rapidly, and since you go to various hospitals, what is the COVID scene right now in Mumbai and the rest of the country?
As far as Bombay is concerned, it's pretty safe now. And there are hardly, today also I read there are only some 40 deaths and some 3,000-4,000 cases. So not much, and most of these are elderly patients who also have some comorbidities. So COVID as such is not a threat anymore. And usually we are following routine protocols. We are not insisting on a lot of things now. So patients are also not scared, and it's pretty smooth going now.
Great. That's good news. I hope things continue to be in that way. And a doctor like yourself who's going to so many hospitals, you obviously need to take a lot of care.
Yeah, I mean, we've already taken those vaccine doses and the boosters, and we've been doing it right from the day one. We take it early on. We have been given priorities by the BMC, etc. So we are covered early on. And obviously we take precautions with the masking and whatever is required.
But tell me, doctor, and I'm asking this question with some, fearing that it shouldn't be construed as I'm questioning vaccination. But one of the things which a lot of people are saying is, what has been the point of vaccination? Despite, the two vaccines and booster, people are still getting COVID, the new strain, people are still getting affected by it. So, isme faida kya? What is the point of taking a vaccination? I'm saying, how do you address that query? That doubt.
To me, the point is that it has reduced the morbidity. The new strain, if at all there is a mutation in the virus always mutates, and they will come with different. But because of the vaccine, the morbidity is reduced. Means the patient will not be so severely affected. They might just be positive, a little bit of sore throat or fever, and then they'll be back again. But earlier, the full-fledged COVID was affecting the lungs, ICU, deaths, etc. Those cases are not there now.
And, since you are a senior yourself, have you taken vaccines like the flu vaccine and all those things? Do you take it at all?
No, I didn't take flu vaccine, but we are into hospitals. So occupational health department, some of time, whatever they advise us, we do it. Like we take hepatitis vaccine, we take this vaccine, whatever are professional hazards as surgeons, we have to cover that.
Absolutely. But a very good note that is there. We have, over 60 attendees just now, and some 200 others are going to be watching it perhaps on Facebook and other media that we have. Over to you, doctor. The topic, as we know, is knee replacement and knee care for senior citizens. And who better a person than, we got Dr. Rajesh Dharia to speak about it. and he will, my request to you, Dr. Dharia, is, tell us a little about it, and especially in knee care, and for people whose knees may be in order, and what do they do? And to those of you who have questions, please put them in the Q&A tab. As always, my request is to please mention your age and your gender, and we will put it across to Dr. Dharia, and I will address the question to him, and hope, I'm sure he will answer. We may not be able to specifically talk about medicines and all those things, because we don't want this to be a diagnostic kind of session. But if you have a specific issue, please raise it here, and we would definitely like to address it. Over to you, Dr. Dharia, and please keep sending your questions.
Yeah, so basically, this particular topic of knee problem, or say knee arthritis, is a very common one. And there has been a lot of research over it, and a lot of the common people, they already know about many and most of the things about these knee problems. So commonly known as knee osteoarthritis, as we say, usually occurring in the latter half of the life, unless you have got some problems early on which has destroyed your joint, either because of trauma or some other reason. So usually primary osteoarthritis is wear and tear of your knee joint. And usually the inside of the knee gets worn out more than the outside. So the patients, they start having bending, and sort of the leg starts getting rounded like this. And slowly the weight bearing surface of the knee joint gets worn out, and then it may require a certain uh, we'll have to do something so that the patient is taken care of as regards the pain and the deformity. So if you consider any adult who is over 50, they usually complain of some knee pain if they are not very athletically active or something. Now, obesity or overweight is a major factor in contributing to this knee osteoarthritis. So the basic thing that I would like to tell people is that avoid sitting cross-legged, and a lot of weight is not good for the knees. To remember that the knee is a hinge joint, and it should be only, as far as possible, used in one direction, and the squatting and sitting cross-legged should be avoided as much as possible. If you have any questions pertinent to this particular topic, then I'll be happy to answer, in which there'll be more interaction between the audiences and me, and it'll become more interesting.
Thank you, Doctor. We have quite a few questions that have come in, and I'm sure there'll be more people coming in. So I'm going to ask one question. Doctor, there's a request that if you can come a little closer to the camera, so that,
sure.
Yeah. Yeah. So the question from an anonymous attendee is, after 6 years of TKR, I'm still having pain and swelling, sometimes unbearable itching and discoloration of skin. I'm a male of 70 years of age.
Yes, now that is a very good question. So a lot of patients, this happiness after knee replacement is an issue with many people. And I don't know where you got the knee surgery done. Did you get it done in Mumbai, or have you got it done in outside?
Well, he hasn't said this to us, but
yeah.
But let's take it as if he is.
Yeah, many times there are many reasons. One is the site of the incision. Then the other thing is, if the nerve which is crossing the incision is cut, then there'll be paresthesia there. That is two. Sometimes if the patient is diabetic, that is another thing. And then another thing is drying up of the skin. Then the habits of the patient, if they are kneeling or something like that. And there are multiple issues with that. I need to see the patient with the photographs. I also need to see the x-rays of the patient and make sure that the implant, everything underneath is proper. So there are a few other things also which I'll need to see. before I really say why these things is happening.
So, those of you who are here and would like to consult Dr. Dharia, we will, put his number at the end of our takeaways that we carry on Mondays, and the edited extracts that we'll carry on Monday. So we'll put his coordinates over there, and you could perhaps do that. Or perhaps, Dr. Dharia, could you tell us where people can connect with you?
They can basically, I have my number, which is 9820000753, wherein they call. Either of one of my assistants will answer the call and give them the appointment, and they can come and consult me, and then I shall be able to guide the patients as regards their problems very happily.
I'll just take your number again, Dr.
982000 and 753.
All right. So I have put Dr. Dharia's number on the chat. You could, connect with him or his office, and then you could do that. So the person who had responded, if you want, you could get more details from him. We have a question from Mr. Chinmay Shah, who says, "I'm Chinmay Shah, male, 60 years old. My knees are in order. What precautions should I take to maintain them and avoid a surgery in future?"
Okay, first thing is that, as I said, that you try and make sure that you don't gain a lot of weight. Your BMI should be normal as far as your height and your weight is concerned. That is one. Secondly is that you should avoid sitting cross-legged, okay, and squatting. These two things will spoil the knee faster. And also make sure that you don't have any osteoporosis, etc. And these are the basic things that you need to take care.
All right. We have a question from Kalpana Ajgaonkar, who says, "I'm 64 in age and have had knee problem of the left knee ligament tear since 2015. And there's a lot of pain and which is unbearable."
Now, when you say ligament tear, if you had an anterior cruciate ligament, how old she is? 60, you said?
64.
64 is an advanced age. And so probably at 59, if you're saying 57 or 8, you damaged your ligament. So if it is an anterior cruciate ligament which was torn, and usually at that age, people don't go into reconstruction, and it is usually treated conservatively. But then if the ACL is torn, the knee will go into osteoarthritis very rapidly at that age. So I will have to see your x-rays, and we'll have a full length x-rays. We'll also like to consult you and see if there is advanced osteoarthritis. And if you are very unhappy, then obviously you will need a procedure. Right. Among the procedure, there are two types, like there is a unicondylar where only the half of the knee is changed, and there is a total condylar where the full knee is changed. In your case, if the ligament is gone, then the half knee is out, and obviously you need the full knee.
Doctor, which takes us to another question, and I'm not very sure, how you're going to address this and respond to it. It is, what is the approximate cost of knee replacement?
The knee replacement nowadays is not at all expensive. It is like any other surgery plus the cost of the implant. Now, Mr. Modi has reduced the cost of the implant to minimum. I mean, all the implants are at around within 60,000 to 65,000. So you are only adding that to any other surgery. Like if you are having an appendix, or if you are having an abdominal surgery or a hernia, whatever, just add the implant cost to it, and that is the cost of your knee. So there is not much to it. There are a lot of hospitals having packages also. There are lots of things. I don't think you need to worry about the cost.
And it's in how many days does one have to be in the hospital?
No, nowadays there is a, actually since 2000 in the US, they have started daycare surgery. So for those patients who are fit, who are not diabetic and who are not very overweight and all, and who only have knee problems, only arthritis and all that, in the US, they have started in year 2000 to do daycare knee replacement. Then the patient was operated in the morning and then discharged next day. So that is slowly that culture is coming to us now after 22 years, that we try to discharge the patient in 2-3 days. If critical knee is to be done. If everything is all right, then we discharge them in 3-4 days. So not a problem at all.
Another question that Mr. Bharat Mata has asked is it essential to replace the knee, or is there any other technology which where knee replacement is not required? He says his knee problem has just started, and I guess that's the question, reason why he's
If the knee
asking.
problem is just started, then no. I am a very conservative I'm a very conservative surgeon. Please understand that my philosophy is that the patient should be sort of operated upon only when he wants it, he or she wants it. So I usually tell the patient that you kindly, you do your exercises, and some people want to try yoga, some people want to try homeopathy, Ayurvedic, some people want to do acupressure, acupuncture, some hydrotherapy. Some people used to, they want to wear belts, braces. They want to try all sorts of things. So I would say that you whatever comes to your mind, please go and do everything, so that when you come for a surgery, you don't have any regrets that, I should have done this or I should have done that before I go through the knife. So I'm very conservative. I never force any of my patients to undergo any surgery, because obviously there are two sides of a coin,
Yeah, but doctor,
And,
is a
yeah.
delay okay? For instance, if I need a knee replacement surgery, then any further delay will only, impact more organs, etc. Right? More parts.
No, it is like this, that any delay in this particular field, it is just taking out the quality of your life for those years. And the knee replacement surgery is not a life-saving surgery, as you know, or it is not a limb-saving surgery. It is improving your quality of life. So there are people, who will sit down at home with chronic knee pain, for years together. And then slowly, the depression sets in. The activity level goes down. Some of them are housebound. Some of them are even room bound,
Right.
So these things are setting in. So the delay will that. The other thing is delay is that if the deformity increases, then we'll have to use more advanced type of implants. You will have to use accessories to those standard implants, which may have the cost go up, which may also have the rehab prolonged. If the patient has not been walking long distances, or he's been in a lot of trouble for a long period of time, obviously they'll take longer time to rehab and recover. That's very basic thing. I don't need to tell you. See, it just comes as common sense to everybody. So these are the aspects where one needs to understand this.
Right. We have a question from Purushottam Jha, who's 65. He's a male. He's having osteoarthritis for the last 3 years. How soon should a surgery for knee replacement is required, and how long can I do without it?
As soon as you want it. Mr. Purushottam, there is no direct formula as to when you should have it done. It is how incapacitated or how discomforted you are. You see, because I have seen so many patients who were advised surgery because the X-ray showed that you have got osteoarthritis, and then the patient decided, no, I will not do it, and then they carried on for 6 months, 1 year, 2 years sometimes, and then they say, oh, that doctor was telling me do it immediately. So it doesn't work that way. You see, it depends entirely onto you, as I'm telling you, that it is only going to improve your quality of life. So,
but is it a case like, say, for instance, you are driving a car with a flat tire,
Yes.
So if you drive a car with a flat tire, then you're sure that if it's not a tubeless tire, you need to get the tube changed, or you need to perhaps get the tire itself changed.
Absolutely. Now, what you are saying is absolutely correct. But ultimately, it is in the mind of there are so many different kinds of patients with their expectations and with what exactly they want out of life, you see. And the only downside to this is that when the knee gets a bit unstable, when they are not even able to walk properly without an aid or something, there is a chance that they will fall down and they'll break the hip. So do not wait till your knees really become unstable. And if they're unstable, then that is one area where you need to really rapidly consider having a knee replacement done, so that you are steady in your feet. This is one aspect. Second aspect is that if you are waddling too much, from side to side because of your knee imbalance, then your back will get spoiled. then you will, in addition to having, as you said, the tire, because of a bad tire, the entire car will get spoiled. Similarly, because of your bad knee, your back will get spoiled. Then the back will require a surgery.
Right.
These are the things which one should understand.
We have a question from Shrikant Kulkarni who asks for knee care, are vitamin D and calcium tablets helpful?
Yeah, vitamin D and calcium tablets are definitely helpful because they will reduce the osteoporosis, not osteoarthritis, but the osteoporosis of your bones will be reduced. Wherein what will happen is that during surgery, any iatrogenic or some fractures which means usually it hasn't happened with me, but I have seen it has happened with some people when they try to hammer the components in. If the bones are very porotic, they can break. That is one. Not even after surgery also, if the bones are porotic, then after 3 years, 4 years, 5 years, or many, if the vitamin D, calcium, and osteoporosis is not taken care of, one can sustain a periprosthetic fracture. So all these things can happen if your bone density is not taken care of.
Okay. We have a question from Rajiv Sethi who
Yes.
asks, is the Indian way of sitting down and on the ground for puja, is that okay?
No, the Indian way of sitting down with legs crossed is not a good thing because, as I mentioned, if you see the mechanics of the knee, it is a hinge joint. So a hinge joint is supposed to work in one plane, in one direction, you see. But when you sit down with legs crossed, you are twisting. You are actually creating a lot of pressure in the medial compartment or the inside compartment of the knee joint. Okay. And then the knee, the inside of the knee, it comes into contact, this part will very badly come into pressure, and then there is a chance that the medial inside of the knee will wear out much faster.
So, doctor, my question then is that from what age do you think, assuming that the knees are fine, and assuming that a person is not obese or whatever,
yes,
from what age onwards do you say that one should stop doing, cross-legged puja?
No, I would say that as far as our Indian ancient culture is different, the yogis and the sadhus and all, if you see the Rishi Munis and all, they have been sitting cross-legged, and you will tell me they don't have a problem. It is not like that. You see, there are only few people, some of them are legs jointed. These legs jointed individuals are different, wherein the mobility or the laxity in the joints is more, and they are usually used to doing all sorts of exercises and mobility, and they are not overweight. These are different category of patients. Okay. But the majority of the patients are a little bit overweight, and they are not in exercise regimen, and they are only sitting cross-legged and actually damaging the inside of the knee, the medial compartment of the knee beyond limits, you see.
Right. Doctor, we have a question from Mr. Rajiv Sethi who says, my father is 85.
Yeah.
He can't walk because of knee problems. We can't operate because of medical complications. Any painkillers, will they help?
85 means basically you will have to monitor the kidneys, and if the kidneys are, you have to give the safest possible drugs like paracetamol, which will not damage the kidneys and will control the knee joint pain as much as possible. Now, many of these patients, if they are not diabetic, or if the diabetes is in control, you can have an intra-articular injection, which will give you a very substantial pain relief for a long period of time. So there are a lot of options for those patients who cannot be operated upon, or those who have a mindset of not getting operated. They can sometimes benefit from an intra-articular injection.
Right. We have a question from Mr. K.A. Suryanarayan.
Yes.
Suryanarayanan, who's 70 years old. His question is, I'm having knee pain without climbing the stairs. I have consulted the ortho surgeon. He said the fluid is getting dried. Presently, the situation is not very bad, and he has advised me to carry on. And when it comes to the unbearable, the remedy is to go for a knee replacement. However, as advised by my friend, I consulted another doctor who advised me not to take an injection to the knee, but I did not take so far. Who advised me to take an injection for the knee, but he's not taken one so far. He's confused. Do you advise me to go ahead and take the injection?
Actually, I cannot advise you like this because I don't know if you are diabetic, number one. I do not know I have not seen your X-ray. I have not seen whether if you have any flexion deformity or no. I don't know if you have any other deformities in your knee. All right. I don't know how much is your walking distance. And there are a lot of things which I need to see you. Okay. Only then I can advise you. And you are already, how old? You said 75 years of age.
70.
Yeah. So at 70 years of age, mostly all your X-rays may not be looking that good. I will have to see them before I give you an advice. I'll also have to counsel you as regards what are your options as regards surgery, etc.
So, Mr. Suryanan, we've given Dr. Dharia's number on the chat window. And those of you who would like to speak with him, his office, you can connect with him on 98200 00753. I repeat, 98200 00753. We have a question from Katie Dadanchi, who says, Doctor, my husband and I are in our early 70s. Would taking glucosamine tablets daily help the knee cartilage? What tablet would you suggest? So far, we don't have any major knee problems. Without taking Shelcal, and would taking Shelcal 500 daily be good for us along with Uprise D3?
Glucosamine and chondroitin sulfate, they have been sort of said that it will help, but it usually does not help. Okay, these are by and large painkillers. They are not going to, the claim is that glucosamine and chondroitin are the nutritional supplements for the cartilage formation. Okay, but these are claims. There is no proven element that taking these chondroitin sulfate or glucosamine orally, it will regenerate your cartilage. There is no proof to that. So by and large, most of these are, in the end, they serve as anti-inflammatory and reduce the pain. That's it.
Right. We have a question from Mr. Venu Murthy, who says, I'm 65 years old with a weight of 63 kgs. I'm non-diabetic, non-alcoholic. I suffer from little knee problem, osteoarthritis for the last 1 month. It is opined that as regeneration of cartilage just started the inflammation. Now, please advise me suitably.
No, the cartilage, the knee cartilage is a hyaline cartilage. It does never regenerates. So if somebody is telling you that the cartilage is regenerating, then there is some misunderstanding with you. The knee cartilage never regenerates. It is hyaline cartilage.
Right.
So it might be that you have some reduction of the pain which you had earlier, but that's about it. The cartilage is not regenerating. All right. If you want to actually compare, you can do your MRI, okay, and then repeat the MRI, and you will see that the cartilage has not regenerated. You see, the hyaline cartilage is never regenerated, and it is only replaced by fibrocartilage. So it does not really regenerate. Please note. Okay.
Right. Just 1 second. I think Dr. Justin is.
Yes. Say.
All right. So we have a few more questions, Doctor. We are so many questions, and the response that is received is just shows how much people need information, and they're so happy to have you here. We have a question from Brijendra Kumar, who is 77, and he's a male. I have osteoarthritis of my left knee for over 10 years. I've managed so far with painkillers and bit of walking. Sometimes I feel buckling of my knee and severe pain to the extent of finding a place to sit down. I need your advice on safe painkiller. I use indomethacin or at present without other medical advice to manage further. I wish to avoid knee replacement. I can climb stairs but get pain with my coming.
There is nothing like a safe painkiller. Okay. So if you want, you can continue to take paracetamol, which is the the least damaging thing. But you will obviously, if you are taking any sort of anti-inflammatories for a long period of time, then you will have to monitor your renal profile.
Right.
And it might also give rise to some gastric upsets and other things. So obviously you will have to keep doing that.
Right. We have a question from Mr. Colonel Dukal, who's saying he's 78 and he sits cross-legged for 5 to 10 minutes. I have no knee problem except one knee pains at times. Should I stop sitting cross-legged?
Yeah, sitting cross-legged will by and large, sitting cross-legged will by and large help your knee in a great way. Okay.
Sitting cross-legged will
help the knee in a very, very big way. Because I already emphasized that the knee joint is a hinge joint. And
right.
if you sit cross-legged, the inside, the medial compartment of the knee gets damaged because of the increased pressure.
Right. So it will impact the knees, as what doctor has said. We have a question from Sangeeta Handa, who asked, my knee joint has degenerated and there is deformity. How safe is it for TKR?
If the knee joint has degenerated and has deformity, that means it requires a knee replacement. The safety is considered by your other parameters as regards your heart, your lungs, your cardiogram, your 2D echo situation, your any veins are okay or no, your weight, your fitness for anesthesia. These are the things which are important for deciding your safety.
Right. We have a question from Yasmin Todiwala, who says, I'm 72. 5 years ago, I had done TKR. Would like to know how long my knees will last.
Very, very difficult question to answer, because I need to see your x-rays. And if the alignment is good, then usually they last for some of my patients have lasted 20 years, 25 years. So I don't think there should be a problem. Nowadays, the knees are lasting for 20 or 15, 20 years.
Right. We have a question from Mr. S.C. Jain, who's 80. Both my knees were operated 4.5 years back. I have been walking about 4 kilometers daily. Now I have started feeling some pain in one knee while walking. Had stopped exercises. At my age, exercises also give pain. What should I do?
The exercises giving pain after knee replacements are, the reason is that if the patella of femoral tracking is not proper, that is one. Or if there is loosening of the knee prosthesis. These are the two common things which, will, or if the patella button is very hard or a big, or there are lots of issues which are there because of the knee pain after surgery.
Right. Can running on the treadmill, this is a question by Lalit Raj Chauhan, can running on the treadmill on plain and inclined surface, can it cause knee problems?
Running on the treadmill means, depending on how, if you are running, if you are already having a lot of weight, and if you are actually thumping your feet on it, and if you are doing something too much in excess, then it can become painful.
Right. Question for you, doctor. I know you mentioned that people should be satisfied and do everything else, but a question is, does alternative medicine, Ayurveda, homeopathy, acupuncture, etc., help in preventing knee replacement?
I don't know if they prevent it, but there are a lot of people who feel relieved or who feel better with it for some time, some period of time. Sometimes if they want to, suppose if there is a marriage in the family, or they want to tide over the crisis or something, then they do some of these things and they feel little better for some time. Now, I don't know why they feel better for some time, and they again go back to the same square one, you see. And ultimately it is just sort of buying time for them to reach the final destination of surgery.
Right. We have a question from Mr. Basavaraj Nagashetty, who says, I'm 64 and suffering from arthritis. I have consulted many doctors, all opined that only total knee replacement surgery is the option. I'm 5 feet 10 and weight is 94 kgs. I have difficulty in walking left, left knee 70% damage and right knee 25% damage. Doctor suggested both knee replacement. My question is whether I should go only for left knee or both.
Depending on how bad both your knees are, I have to see your x-rays. That is the first thing. Second thing is I have to examine you personally. These two things cannot be replaced for giving any opinion. But by and large, if you feel that one of your knees is worse than the other one, then just go for the one knee and see if you feel better with it. If you can always get the other done later if you are not convinced about the other knee,
Right.
if it is not equally bad.
Right. We have one last question, the two last questions. We have from Sangeeta Handa. I'm 61 and suffering from rheumatoid arthritis since the last 25 years. My knee pain has degenerated and now deformed slightly. I'm undergoing treatment for RA. How safe is the knee replacement surgery?
Knee replacement surgery nowadays is pretty safe. We have been doing double knees for a long period of time now. Almost 20 years I have been doing double knees without any issues. Obviously, the selection of the patient is very important.
Right.
For rheumatoids, they have issues with their hemoglobin, they have issues with their immunity, they have issues with their general body profile and other issues. So obviously, we'll have to make sure that you're fit enough before you undergo any sort of surgery.
The last question is, what is the relation between high uric acid levels and knee problem?
It has a good high uric acid will give rise to your joint pain, be whether it is a knee joint or whether it is a shoulder or whether it is a foot joint, etc. But by and large, it has been documented that the foot joints are more affected with the uric acid, and gradually the knee joint also will be affected. There are some people who have predominantly knee joint affected because of increased uric acid also, and it could really be painful. So obviously, if it is high, you need to take your uricosuric drugs, and
Right.
you also need to take allopurinol, and there are other new drugs which are also there, which you can also take.
Right. Doctor, there are quite a few questions that are still there.
Yes, I'm sure questions will be there.
Marjorie Fernandez asks, I don't have any pain in my knees, but they seem to be permanently swollen or inflamed. I used to do quite a lot of walking until my accident last September. I don't walk much now, although it's not due to my knee problem. The ortho doctor who said who saw my leg bone x-rays thought I could manage for the rest of my life without a knee replacement. I want to know if long-term inflammation is harmful, partly for the fact that it doesn't allow me to wear churidars or other pants which are tight at the knees. Should I take calcium and vitamin D3 on a permanent basis?
Vitamin D3 and calcium, you must make sure that you are taking, as long as you're monitoring your D3 and you're taking adequate calcium for your age, etc., and your bone density is maintained normally, it will be good for you. However, I cannot tell you that it will reduce your knee swelling, etc., unless I have seen and documented as to the reason for that knee swelling.
Right. Thank you, doctor, for being here. There are a few questions that are still be there, but some of them have been asked. I'm not specifically looking at exercises because we are going to be having a session on physiotherapy very soon, and so please do wait for that. Doctor, before you go, I must tell you that we have completed 3 years of Seniors Today. It's our 3rd anniversary issue.
Congratulations.
Thank you very much, and it's thanks to everybody who's associated with us, and all the doctors who've come here every week, every Saturday, 5 o'clock. Sometimes at short notice, sometimes it's well planned. It has been an amazing journey. It is amazing to have people like Dr. Rajesh Dharia who are connected with us, not just once, twice, perhaps some doctors have come in even more than twice. So it's a real pleasure, and it's a vote of confidence in what people like him, doctors like him come and speak to all of you. So thank you once again. Thank you for keeping the faith. Thank you, Dr. Rajesh Dharia, for this very informative session. You've answered so many questions. Some questions we've not been able to answer. As I said, we will be having a quick session on physiotherapy by a top physiotherapist of the country. Please keep in touch. We will be back again next week. That is next Saturday at 5 p.m. for our next session of Health Live at Seniors Today. Once again, thank you, Dr. Dharia.
Thank you so much for inviting me for this particular program, and I hope I have answered most of your queries. And
You did, doctor, and very well. Thank you very much.
thank you so much. Have a nice day and a good weekend.